Okay, we're going to try and stay as close to on schedule as possible. And what I'm going to do now is I'm going to invite all of the Category A's to come to the stage, and they're going to introduce themselves, although I'm going to take the liberty of introducing what will be your first dynamic duo or your next dynamic duo, which will be Jill Birnbaum, Vice President of State Advocacy and Public Health for the National Center of the American Heart Association, as well as Laura King-Kahn, who is the Senior Program Manager of the Anchor Partnership Program of the American Heart Association. They're going to be the first of your Category A or national organizations to share about their organization. So if you could give them a hand.
Good afternoon, everybody. Oh, everybody enjoying New Orleans? You know, it's been 1 year now of smoke-free air in New Orleans, so we've got plenty of reasons to be celebrating here. So, my role with the initiative is I'm the Vice President for State Advocacy and Public Health at the American Heart Association. I serve as a principal investigator. My role here today is just to give you a little bit of background on the American Heart Association. My apologies to the American Heart Association staff in the room. This is all stuff that you know. But for our partners with other organizations, again, just to give you a little bit of background, and then Laura, who serves as our program manager here, is going to give you a little bit of background on how we're approaching our work in particular with this opportunity. So how many of you are familiar with the American Heart Association? I assume most, if not all of you. Our mission is building healthier lives free of cardiovascular diseases and stroke. And up here, I'm going to talk in particular about some of our current priorities and how we approach our work. But these are our guiding values at the American Heart Association and really drive when we approach our planning first in terms of how we meet that goal. These are the guiding values. And you see one of the particular that I'll highlight here is the building powerful partnerships. And it's one of the key reasons why opportunities like this are things that we were very excited to be a part of, because again, building powerful partnerships is one of the leading values of the association. One of the things to note is we set every 10 years a big, hairy, audacious goal. And in 2010, from 2000 to 2010, that goal for us was largely focused on mortality. So in particular, reducing cardiovascular disease mortality by 25% by 2010, which I'm pleased to say we actually achieved. We actually overachieved on that. I believe it was somewhere over 30% during that time. But the other things that we measured at the American Heart Association were individual risk factors. So cholesterol or tobacco use, things like that. So those individual risk factors were also things that we measured. But when you really look at the mission of the American Heart Association, again, to build healthier lives, we were saying more about what we were trying to keep from happening as opposed to what we wanted to proactively do. And so a really important concept going into our planning process from 2010 to 2020, so setting our 2020 goal for the American Heart Association was how, instead of reducing mortality, might we improve cardiovascular health? And the challenge in that process of getting to that understanding of the more positive approach of improving cardiovascular health is, how do you measure cardiovascular health, right? We had never as an association, and frankly even as a nation, if you looked at like Healthy People 2010 goals, they were again all focused again on mortality and risk factor work, but not on that overall look at cardiovascular health. So we convened a group of epidemiologists and biostatisticians and other really key leaders in cardiovascular health improvement and tasked them with help us define cardiovascular health. And they both looked at both the things that we thought we should measure as well as what we could measure, right? For those of you who work in public health in this room, there's also the challenge of data and surveillance of what you can monitor. And these are the 7 factors that essentially became a part of that overall kind of composite measure for us of how we were going to improve the overall cardiovascular health of the nation, and you'll see later by 20% by 2020. And so those are all being factored in what we do, and if you're interested, see me in a break and I can point you to the journal article for those of you who want to geek out about this stuff. But each of those risk factors goes into how we then classify individuals at an individual and a population level into either low cardiovascular health, intermediate cardiovascular health, or ideal, which is where we wish everybody could be, which is an ideal cardiovascular health, where essentially most of us are born with ideal cardiovascular health and we find a way to mess it up in some way throughout our life. But again, how do we help people either who are low cardiovascular health move to intermediate to ideal if that's possible? So so it turns out that a very low percentage of the adult population actually is an ideal cardiovascular health, and there's one measure here in particular, one factor here in particular that largely leads to that. For the non-AHA staff in the room, which of these, by number, do you think it is? It's actually 3. So it's actually eating pattern, and the eating pattern itself is actually a composite measure because it contains a variety. It contains things like sugary drink consumption, but it also contains our sodium measure. And as a population, we eat way too much salt, going to Dr. Jack's point earlier, so way too much salt. So it turns out salt is really what tanks most of us in adults when it comes to ideal cardiovascular health. We approach our work in terms of our strategic work through policy change, system change, what we call conversation change, so engaging the public in our work and accelerating science. But that work that we did to develop that measure has led us to 9 areas that we've identified that are key to the success. If we're going to achieve that 2020 goal, these are the areas, the 9 impact priorities that we've identified. And you'll see, and I'm kind of getting the punchline of what my role is to tell all of you, you can see why this opportunity for the American Heart Association was so important to us, because there are a number of areas here, in particular in the primary areas of primary prevention, that really will help us in terms of achieving our 2020 goal, which again for us is to improve the overall cardiovascular health of the nation by 20%, also reducing death and disability by 20%. One thing that it has also done for us, this opportunity, for the AHA staff in the room know this well, if you've worked with AHA, you probably worked with us in a lot of state-level policy work. This has really expanded our ability to also work locally, and again, fits well within our pre-existing goals and accelerates and expands our current work. With that, I'm going to turn it over to Laura to provide you with a few updates on where we are in terms of our work with Cohort 1 and Cohort 2. Thank you.
So with that, we were really excited to when we went through the exercise of identifying where we were going to be doing this work in the first cohort, we were actually able to cover 13 states. So we had 15 locations, and we were able to cover 15 states. And those states, actually, those activities, those particular markets focused on a variety of efforts based on local needs. There was a community assessment, as I'm sure you've heard through your other partners. They had to go through the same exercise. And so essentially in cohort 1, we had 8 sites that were focusing on healthy food and beverage options or procurement policies, 4 sites that were focused on healthy food financing initiatives, 5 sites were focused on farmers markets, and then in we had 3 sites that were focused on smoke-free, and 2 that were on shared use, and 3 on physical activity. And then in this round, all of you are here representing cohort 2. We actually were able to have 15 sites again, but this time covering 14 states. And similar on the same themes of areas of focus, we have 10 sites that are focusing on procurement, 3 on healthy food financing, 5 on farmers markets, 3 again on smoke-free environments, and then 1 on shared use, and then 3 sites doing physical education. And so we have a number of lessons learned, and for those of us who were in the session with ourselves, our partners, and our for American Heart Association, and those in the room, they got to hear about all the evaluation results. But there were some key lessons learned that we thought we'd share with all of you. And really, one of the things is when procurement's still not a term that is well understood. It's sort of the technical term about increasing access to healthy food and beverage choices within government buildings or other public settings. And so one of the things is that it's not a very one-size-fits-all sort of approach that one has to undertake. So you really need to think about sort of what is the route and the avenue, and do that investigation around how are the vendors set up within government buildings? Because there's different leaders and decision makers depending on the scenario. And one of the other piece around this is that with procurement, if you're in another setting like workplaces, there might be intermediary decision makers, and then the CEO may actually also have to buy into this the project. And then in schools, another setting, similar kind of approach, except for, sometimes those school food directors are actually the decision makers because they're in charge of the food lunch programs. So understanding who the decision maker is and who you need to actually work with really is going to be key in order to pursue, kind of pursuing this effort. And that it is a fairly new area of work for public health, and so it's not well understood. So, don't be surprised if you walk in and folks kind of look at you like you have three heads, because it's not something that's well understood. So wanted to share with all of you some opportunities to see some of the collateral materials. As I'm sure you've learned, communications is a big part of this project, and so we used a variety of approaches through our project to actually get the message out around what we were trying to achieve in this particular area of focus. It's just some sampling of some of the work that was undertaken and developed. Farmers markets, lots of really interesting work. Certainly the seasonality of farmers markets, especially in northern states, was a challenge. Recognizing also that, so that sort of the tightened time frame for this, the cohort time frame was a challenge, but then also you add the actual shortened time frame for farmers markets in general for some states in those normal climates are also a challenge. So that really sort of influenced what we were able to do in terms of accomplishments, but needless to say, there were some interesting nuggets which are probably not a surprise when you look at this list. Essentially that, there is a need to sort of get over sort of the perception around the availability, but also the affordability of farmers markets. Somehow they've been branded as being not affordable for some populations, that even though when you actually go there, you actually realize the pricing points are affordable, and that there's not it's not well understood that some farmers markets are able to accept SNAP or WIC benefits, and so we did spend a lot of effort in that. Some of our markets actually spent effort in actually trying to educate the public on that, and particularly those populations in general. And then there is sort of this confusion around the ability and the lack of awareness around mobile markets and how those fit into the greater system. That said, those who are starting to use those to supplement their food access, utilizing farmers markets and mobile markets are becoming greater acceptance around that. So it's starting to see more of a norm. So just another sort of example around how we were able to, in a number of our markets, actually built similar guides to this. They were actually sort of advertising essentially where the farmers markets were located and what they could expect when they actually got to those markets. So they would actually not only be able to get a bit of a legend around, is SNAP or WIC accepted, but then there was a lot of efforts, both grassroots as well as, broader communication efforts to really try to get the message out around what can be expected when you go to a variety of these farmers markets and mobile markets. I know, I'm being told I need to wrap up, so so lots of really exciting lessons learned around healthy food financing, and I would just say one of the things that here, what we realized is the power of the communication strategies. And actually identifying those local champions. So one of the things that was so amazing, and later on through the next couple of days, you'll get an opportunity to see some of there's going to be a showcase of some of the media that was covered or different activities that was undertaken, and so we actually, the local market here was actually able to get a news anchor to do some showcasing around the issue around food deserts, and actually that was a really powerful strategy for within this community. So more sort of examples, and in terms of physical activity, since I am running out of time, I won't be able to read all of these. These slides will be available after the fact, and so you will be able to learn about that. But I wanted to sort of say there was a lot of really great effort here. We took polling results. Actually, we were able to create infographics. Those were used to continue to leverage and build momentum within school settings, with parents, with community members around the importance of PE and physical education, and the importance of making schools available through shared use policies. And there were a variety of other press releases. All right.